Now, as part of the journey, there's the external journey that anybody can see. You've got cancer, you've got a diagnosis, you're getting chemo today. And then there's the internal journey. How are you dealing with it? And you all are leaders in dealing with the Commission on Cancer's recommendations about doing surveys of distress in patients. I know from my own small journey, which was fortunately nowhere near as traumatic as my friends, that very seldom do you get asked, how are you feeling about all this? What can we do to make this next 4 hours better for you? Are you getting enough attention when you need it? Do you feel like everybody in the building is giving you some leeway here? So it's not just the nurse in the chemo room who knows you have cancer, but everybody from the moment you walk in knows that maybe you're walking a little slower today, or maybe you feel a little nauseous today, or maybe you're depressed today, and they greet you with a hello instead of a what do you want. The best institutions do that. I know at the Cleveland Clinic many years ago, Toby Cosgrove, the CEO, set a standard that everybody from the people who clean the office to the people who run the clinic treat everybody like they're kings and queens the moment they see them. No matter who they are, they greet you with a smile and ask if they can help, even if they have to stop mopping the floor to do it. That's what we need in every institution. So it's not just what is visible, it's what is invisible. And the other thing that is too often invisible that you know better than most is what is referred to, I know, as financial toxicity. How am I going to pay for this after I go through this? Can I pay for this? I know too many doctors who put people in hospice because the patient has chosen not to bankrupt the family for an extra 6 months. This is unacceptable. That is not a choice anybody should have to make. And yet they make it every day. And you know this better than anybody. So most people don't like to talk about either their distress or their financial toxicity. And that's why I refer to it as their inner journey. We view financial toxicity in some cases as more embarrassing than saying you have cancer. People have gotten over saying they have cancer and not worrying about what people will think of you in many cases, I hope. But people still worry about saying, I can't afford that to anybody, much less somebody that they've just met in the hospital. Can the cancer moonshot help with that? Can Joe Biden help with that? Absolutely. And we are going to continue working on these kinds of issues because you cannot deal with any part of the journey without dealing with all of the journey. You don't get to stop halfway through. You have to go all the way. And that means if it's a problem for you, the patient, the person, it's a problem for all of us. And we have to treat it that way. So where do we go from now? What exactly is going on? We have an election. We have a new administration. My charter, the charter of the task force, expires on January 20th. But as I said, the moonshot does not expire. It will not expire. Vice President Biden will be setting up his own way of doing this in the private sector. I am going to be helping him do that. We are going to be reaching out, just as we do now, to groups like you, because we know the power of your work. One of my colleagues lost her mother 7 years ago next week, and she used your support community during the worst time of her mother's treatment. It meant an amazing amount to her. And since she is a nurse herself and was an oncology care administrator before I stole her from New York Presbyterian to come work for me, she has seen this from many different sides, as I have myself. So will the moonshot continue as a government program? Maybe not at the White House, but the agencies that have started the programs, those programs are being run by career people with existing budgets. And personally, I find it unfathomable that anybody who is running those agencies would say, stop working on cancer, even though it's your mission and it's your money and it's your career people. I can't imagine anybody would say, let's throw away those cancer programs, especially because there is not one thing that has more bipartisan support than the Cancer Moonshot program and the work that you and others are doing for cancer patients.